Originally, whenever I told my friends I had applied for mental health nursing, they were a bit shocked, and they didn't see me as in their eyes, what a nurse would look like.
Following leaving school, I worked as a plumber. I was telling my workmates, that I was thinking about doing nursing or something. It was supposed to put me off doing it because of what they may think or say. But following actually telling them I was planning to do nursing, my fears were actually completely misplaced.
As I progressed through my degree and they started talking to me and asking me about it, their viewing it softened.
So it turned out what was actually discouraging me was actually a figment of my own imagination. I shouldn't have been thinking of it at all.
I never really thought of the role that males had in nursing. I went to an all-boys school, so nursing was never put forward to say, Conor, you could go on and be a nurse. It was never really relayed to me, it was never really relayed to anyone. What encouraged me would probably be a younger brother with learning disability, so that empathetic maturity. My mother had a good insight to that. She'd always say, Conor, you'd make a great nurse.
My father and uncle are both mental health nurses, and I also have an auntie who's also a nurse. When I went to my secondary school, in the last 5 years I was there was only 2 guys who went through the nursing, me and another guy I knew who was 2 years above me.
I got work in a nursing home, which was good because I kind of at that stage and you wanted to do nursing, so it worked out well, and I just loved it.
I was working in a residential home with people that had a learning disability and mental health illness, and it was just there. I found the work very rewarding.
Friends were coming to me with problems, and I found myself always trying to solve the problems or helping them in a way as best I could.
Young males are actually a very vulnerable group to mental health issues.
The local area that I grew up in over the last number of years there's been a high rise in suicide rates in the town, and I think that's something that needs to be addressed, and hopefully I can help with that. That's why I'm studying mental health nursing.
When I worked with a few young fellas with learning disabilities, I found they responded better off men. And sometimes that is the case where men respond better with men. Men feel more comfortable talking to men.
I think even from working with patients on the ward in placement, that they appreciate there being a male presence.
In a lot of recent years, people have been going on about gender equality and trying to get more of a balance in work of men and women. So I feel like it is definitely more important to get more males into nursing to kind of cause more of a balance.
The boys I've met here is probably some of my closest friends now, and some of the best lads I've met, so it's 100%.
Very fortunate to come in and spend time with 5, 6, 7 other lads who are in the same frame of mind, and that also eased a lot of my anxiety and a lot of worry about being a male in nursing.
I was actually really surprised how many guys there were. I thought there'd be far less.
We're all together, and that sense of camaraderie is massive, and you really feed off it and grow from it. I think together we've all grown.
And then when you get out in placements, you see a lot of males in nursing, and they're very, very good, and sort of help you as best they can. And when you're doing assignments and you're under academic stress, or you're in placements and you're under stress, the stuff that you're learning, the stuff that you're doing is very much applicable to everyday life. Having a tight group in class and having supportive staff means that when you're in placement or whenever you're having a tough day, you can always relay how you feel, and you're always met with people who understand the same way that you are.
For me, a friendship group's very important. Someone you can rely on, and even fellow students who are going through the same thing as you, who you can bounce ideas off or bounce struggles off.
I know it's a bit of a cliche, but having the balance right definitely helps you in both sides of studying and play.
I'll go and play a football match, or I'll go to the gym or something like that, just to sort of relieve stress, and I come back fresh, ready to start again. Following my graduation, I would like to secure a post in an inpatient ward somewhere, and then just try and help as many people as I can.
I'd like to see myself in an acute mental health ward, just even to gain experience working with individuals experiencing a wide range of illnesses.
I'd like to work in the wards for a few years and just find my feet and go from there.
I plan to learn as much as possible in the beginning, and hopefully eventually move towards community, or maybe travel. That's one bonus of doing a nursing degree, is nurses are needed all over the world.
I know whatever I'll be doing happy if I'm in mental health nursing, and I'll be keep going forward and progressing.
You never know where I could be. I could be travelling with my nursing as such a great degree to sort of go travelling with, or I could be working at home. But I plan to be happy, and I plan to have a greater idea of what I'd like to specialise in, and hopefully develop my career as best I can. Nursing was never at the forefront of what I wanted to be. Nursing was something that I had to learn over time to become, because as your maturity develops, so does your scope of understanding what actually a nurse is. I'm very happy with that choice I made. I'm very happy communicating to young fellas. I'm very happy with the fact that Queen's give you plenty of placements to hone in your skills and accommodate you as best they can, especially as a male, and of course as a female too.